we'll cover about that. Okay. And as for slurry speech, can you tell me how long you're having the symptoms? That's it. Well done. So we are on the approach. I'm going to share the screen again. Guys. So I'm on the approach of data gathering and history taking. It's very important. So I was on Meftosa. So when you will be on Meftosa, this approach I'm not only covering for chest pain, I'm covering for everywhere where you'll be able to know, okay, this is my consultation would be flowing. My consultation would be flowing fluent. So I'll be doing this. After that, after red flags, then, for example, you got headache, ask symptoms from the same system first. Same system, then go to the DDs for the DDs. Ask 1 or 2 questions. Guys, I want to tell you one thing. When you are going to ask DD, for example, I ask you DDs for chest pain. Write down the DDs in the chat box, and I'll point out your mistake, what you are doing. Write down the DDs in the chat box. How would you ask DDs about the chest pain? I want to tell you in PLAB 2, you need to ask DDs in simple words. Simple words. Don't even ask like heart attack, or just ask simple words. Like I have written down in the algorithm, back pain and swelling and sudden difficulty breathing and cough, like simple words. Okay. So this is what we need to know. Then coming to the general background. In general background, you'll ask about Meftosa. So you'll signpost it, thinking about your general health. Do you have any non-allergies? Simple questions. Do you have any family history of heart, high blood pressure, or what do you do for a living? Never ever forget about the lifestyle as well. Driving. Lots of people forget about driving. Do ask about the driving as well. Now coming to the ice. So my question is, guys, you can miss ice. In PLAB 2, you can miss ice. In 16 stations, you can miss ice in every station. Yes or no or sometime. Answer. Thank you. You can miss ice in your consultation. I'll tell you why you can. Zara, they can miss ice.
Wait, sorry.
In any of the PLAB 2 consultation.
No, they can't, because you have to explore what's in the patient's mind.
Okay. Yes, I want to tell you.
Ice is like exceptions are there, but most of the cases.
Only one exception it could be in Simman anyway, because the patient is dying. So that moment
yeah, there are some, like in the emergency, maybe the patient is
an emergency situation, because
they're not going to relax enough.
Well, if you want to pair PLAB 2 again, in PLAB 2 again, you can skip ice. How to ask ice? Don't say, do you know what? Do you know your diagnosis, or do you know what's going on? Don't ask in that way, because if you ask that, mate, you are doctor, you tell me. You will evolve. You say, Michael, it's been going from 2 months, 3 months. It's quite a long time. Might be you have given a thought. Anything come in your head? What's going on? You can ask in that way. So what's going on? You will ask about that. What's going on? Michael, have you ever given a thought? What's going on? In this way, you will ask about that. Then concern. You will ask about, by any chance, Michael, anything making you worry about anything. So this is very important. Remember 1 or 2 sentences, practice daily, and do that. Zara, ask me ice, please. Ask me ice. Okay. Well, let's say I'm having headache, and I'm not going to tell you anything until you ask ice. Ask me ice. And I'm having headache from last 2 months. Okay. So ask me ice.
So you are having, as you mentioned, that you are having this headache for the last 2 months. Have you given a thought? What could be the reason why you had having these headaches?
Oh, doctor, yes. Might be I'm having tumor.
All right.
I'm worried about that. My grandma has tumor, so that's why I'm worried.
I'm sorry to hear that. We will talk about it in a detail. And is it, apart from this, is there any thing you're most worried about? Like, about your
I'm worried about tumor. Might be. I'm thinking that you might give me, help me to get a CT scan of my head.
Well, definitely, we will talk about the CT scan in detail when I'll discuss, the treatment plan with you and what's going on. So we will talk about the management plan soon. I'll get back to your concerns soon.
Thank you very much. Well done. So, guys, what you have noticed, what Zara has done. She listened to my concern. She listened to my idea. She appreciated about that thing, and that she would come in a minute, because ICE would be before your management. And out of 10 students, trust me, guys, 7 or 8 students, 6 students will skip ICE in 2-3 station must, because they don't have this in the normal consultation. If you make a habit of doing ICE in your normal consultations daily, trust me, guys, that will help you to pass your PLAB 2 exam in first attempt. So never ever forget ICE. So you have done the psychosocial. How you last psychosocial? So again, Zara asked me psychosocial of headache. So it's affecting me. Yeah.
So you are having this headache for a couple of months now. How you are coping with it? Like, is it affecting you in some way?
Oh, finally somebody asked about that. Trust me, my sleep is affecting. My relationship is affected. I had a fight with my husband just because of headache. I had a bad headache. So quite bad. GP is not helping me because he's not giving me any type of medication for my migraine, but this is quite different. Affecting my sleep, I can't drive, I can't work. Please help me.
Well, I can see that, it is affecting you in, just
Yes, thank you.
It's
So basically, I would like to tell you guys, if you don't ask about that, she might the simulator.
we are always here to help you.
The simulator, what the simulator would do, he would have his role play.
Yeah.
He would say, "Oh boy, okay, he didn't ask me. I'm not going to tell you because in the whatever they will get in the written form. Okay, tell this to the doctor if the doctor will offer you pain relief. Tell the doctor if doctor asks. Tell the doctor if doctor is good. Tell the doctor if doctor don't sounds rude. Tell the doctor if doctor is sweet, humble. These type of things they do because they don't want to see that how much good you are in knowledge. Don't vomit your knowledge straight away on the patient mouth, please. That will make you fail. Trust me, guys. But if you go slowly, chunks and check, ask that information, you will be able to pass your PLAB 2. Thank you very much. I'm sorry for the rude words, but I want to tell you guys, if you do that, which we do in our Viva exam when we have to impress our professor, and but here you're not impressing professor. Here you have to impress simulator the patient. The patient would be thinking that how safe you feel in your company as a doctor. This is what you need to do as a doctor. Well done, guys. Idea that examination wise, this is very important point. Okay, tell me I'm right or wrong. Tell me right or wrong. I will do that. Okay, Michael. Now I'm going to check your chest. I'm going to check your abdomen. I'm going to examine your back passage, and I'm going to examine your. I'm going to do ECG. Score me about that. Score me. I don't care. I'm already a doctor. If you score me 0 as well, it's okay. Oh, thank you, Zubda. Okay, no problem. So these 10 days we will be simulating. When we will be doing supervised practice, we will score you. Okay, so let me tell you. Whenever I'm going to tell you one thing for every system, one last time, guys, you want to write it, write it. If you're not, it's okay. So whenever you're going to do the head examination, okay, Mr. Michael, at this point, I would like to check, for example, eyes. I would like to check, do the frontoscopy? No, I would like to check the front and back of your eye. Front and back of your eye, number one, for the eye examination. Then for the nerves, I would like to check the nerves of your face and your arms and legs. Okay. For the chest, I would like to look, listen, and feel your chest in simple words. And I would like to feel your abdomen. No, I would like to feel your tummy. Abdomen is an anatomical. Okay. I will do electric tracing of your heart. That is for ECG. I will do a gel scan. That is for the anything. I would send some bloods to check heart, don't say troponin, to check heart markers. I will send your CRP. No, don't say CRP. I will send your infection marker and we will do the X-ray of your chest. This is how you do in simple words. Yes, and for the back passage examination, Michael, I might have to do the back passage examination in which I will use lubricated finger in the presence of chaperone to keep your privacy. I'll be as gentle as possible. That's it. Well done. Okay. So period history. Zara, please take period history from me. Or you want me to take period history from you?
Yeah, you can take.
Okay, so let's do it. Okay. Zara, thinking about some standard question about your periods, thinking about your periods. Can you please tell me when was your last menstruation period?
2 weeks back, doctor.
2 weeks back.
Yeah.
And are they usually regular?
Yeah.
Okay. Any bleed in between the periods?
No.
Okay. By any chance, currently you're having any bleed from your private part?
No.
Okay. And this is the one way to ask, not spot the errors. What things I have missed? Zara, you tell me. What things I have missed in the period which I can improve on?
You asked about the irregular.
Anyone can tell me what
pain during the period.
Yeah.
Dysmenorrhea. You didn't ask about dysmenorrhea and any clots. passing any clots during the periods,
Okay, yeah, definitely. One thing.
a heavy bleeding,
Okay, well done. Heavy bleeding. Yes, you have to ask. By any chance, any heavy periods? By any chance, any bleed between the periods? By any chance, have you noticed any
regularity,
clots in your? Yes. So by any, that is another P. By any chance you are pregnant, or by any chance you're trying to be pregnant, or are you updated to your pap smears? Because sometimes you think you're taking the full history. I still remember I was referring a patient to the gynecology department, very tough referral. But I told the gynae, I took everything. I couldn't miss anything from the guy. Then she said, is she updated to pap smear? Oh, I said, oh shit, yes. I have to ask again. Because pap smear is important.
The four
Pap-
P's. Period,
Ps, okay.
pregnancy, and pap smear.
So never think that you are not missing anything. So always there is a space of improving. That's why we started ourselves. Doctors are doing well done. So sexual history. Who want to take sexual history from the students? And or Zara, you want to take sexual history? Because I want to make a base of the guys before we go. Anyone? Joyce, you want to take sexual history? Can you take Joyce? Can you Hasham? You want to take sexual history from me? Guys, this is PLAB 2. Sorry?
I said, okay, no problem.
Yes, Joyce, well done. Thank you very much for being with it. Yes, take sexual history from me. And guys, all of you, open your notes, open your Google search, tell me what she skips. But before telling that what she skips, appreciate her, what she have done positive. So you have to take sexual history. I'm 27-year-old male, okay? And I'm worried about HIV, okay?
Okay. Hello. Do you have a particular name I could use, or I should use any name?
You can call me Michael.
Michael, I'd like to ask you some personal questions. Is that okay?
Oh, yeah, okay, doctor.
Okay. By any chance, are you sexually active?
Oh, yes, doctor, I'm sexually active.
Okay. And do you practice safe sex?
Safe sex mean, doctor?
Meaning, do you use condoms?
Oh, no, doctor, I don't.
Okay. Do you have a stable partner?
Yes, I have a wife.
Okay. And do you have any other partners apart from your wife?
Yes, doctor. I had some male partners in Thailand when I was in Thailand. Yeah.
Okay. Okay. And did you practice safe sex with them?
No, I don't.
Okay. I'd like to ask if what type of sexual activity you do. Is it mainly insertive or you receive?
Yes, yeah, it's receptive.
Okay. Have you ever been screened for STI before?
No, doctor.
Okay. Have you ever had STI before?
No.
Okay. Thank you very much for answering my question, Mike.
Okay. Thank you very much. Yes, guys, write in the chat box what she has missing. Well done, well done. You asked almost all the questions, but not all. But yes, guys, please comment in the chat box how you can, because this history should be done well. In every scenario you will be doing related when somebody you're going to say young or anywhere, this history should be okay. Anyone want to write in the chat box with the question about STI? She did ask about question about the STI and how you can improve the sexual history. So guys, first of all is signposting. Is she done signposting well? She did signpost it. Can it be improved? Can it be improved? Our screen for STI, yes, Dinky, that's a good question. Then anyone else want to try, or should I go try, or Zara, you want to try, or you become simulator? And I'll tell you different scenarios in which sexual history you might be taking sexual history, because the approaches are very important to take the sexual history. So Noor, Saban, Zubda, write down sexual history question in the chat box. Write down sexual history question in the chat box. I don't want you to sleep. Joyce, write down the sexual history question. Dr. Fatima, write down the sexual history question in the chat box. I'm waiting. Write down the sexual history question in the chat box. Yes, write down the sexual history question in the chat box. Good. Okay. So few of the ways, there are few ways. Either you are taking sexual history from the male who is gay. You're taking sexual history from female who is lesbian. Okay, so you will see these type of similar scenarios in your exam, or you'll be taking sexual history from the straight. Okay, let's do Zara one in which you are a homosexual female. Okay, and this type of scenario they usually do that, and it is related to pap smear. Okay, and I'll be taking sexual history. You do have You do have sexual partner, female sexual partner, and number one. Number two, you did have male partner in the future, in the past. You don't practice. How I would ask about the safe sex. This is how I'm gonna ask, and this is how I'm gonna proceed to the consultation now. Okay, guys. So I'm trying to take the sexual history from Zahra. She's a female. She's your same sex or so I'm going to take the history. Hello, Lita. Zahra, we can't hear you. Yours.
Yeah, sorry.
Hello, Lita.
Hi, doctor.
At this point, I would like to ask you standard questions about your sexual health to make sure everything's okay. Is that be okay with you?
Yeah, that's fine.
Right. These are some standard questions we usually ask. Okay. So can you ask a question? Are you sexually active?
Oh, yes, doctor.
Okay. Do you have a stable partner?
Yeah, currently, yeah. I have
Okay.
one partner, yeah.
Okay. May I know, is your partner male or female?
Oh, she's a female.
Oh, she's a female. Okay. And how long been you together?
It's been 6 months.
6 months.
Yeah.
Okay. By any chance, your partner have another partner, male partner?
I'm not sure, doctor.
Oh, you're not sure. That is okay. By any chance, did you had any male partner before?
Yeah, before like this relationship, I have a boyfriend. Yeah.
Okay. And how long it was? 6 months before?
6 months before, I have a male partner for like 1 year. Yeah.
Okay.
Yeah.
Right. So may I ask you about your sexual preferences? You always have a same-sex partner, or at this time, or do you have different as well?
Doctor, I'm fine with both. Like I like girls and boys. So, but currently I have a stable partner, like my girlfriend. I'm with her. So
Okay.
yeah.
Okay. Thank you for telling me. And by any chance, it happened that you use any sexual toys as well when you're having like intimate with each other?
Yeah, yeah, we do use. Yeah.
Okay. Can you tell me your sexual preferences as well, like in terms of methods of sex?
We usually use the toys, doctor. Yeah.
Okay, all the toys. Okay.
Yeah.
What about oral or anal?
No, I
Okay,
would say just
all right.
yeah.
I'm sorry for asking this question, but it would help
Okay,
me to
then.
diagnose
That's
you.
fine.
It's okay. And by any chance, you ever had any sexually transmitted disease?
No, no, doctor.
No. Okay. Thank you for answering all those questions, and thank you. So, guys, the point of telling you this scenario or other scenario, when you signpost it, this thing I'm going to ask regarding your sexual health, and it's a standard question. You don't need to shy off. You are doctors, you are going to say a similar complaint every time. Every time you have to ask these questions. If you skip that question, the positive finding would be in this scenario might be she was using sexual toys, which is the cause of transmission of that thing they share. So this is what we say. Yes, contact tracing you can add on according to different situations, but I would like to tell you guys, sexual history, you need to take whole sexual history according to the situation of the scenarios, guys. Well done. So I'm going to share my screen again. I'll quickly finish the approach, and then we'll do Zahra will simulate, will act like a doctor in the scenario. Okay, so I'm going to share my screen and I'm quickly go through the rest of the sketch. Then we'll move to the. So in management, I'm going to tell you again, listen to me, guys. You've done the sexual history. When you come to the diagnosis, what you will do, just give me 1 second. When you will come to the diagnosis, can you able to share, see the sketch? Yes or no? You able to see the sketch? Algorithm. Are you able to see algorithm? Yes. So when you come to the examination, they will give you some finding. Before explaining your diagnosis, you will explain findings. For example, they give you finding on ECG. First, explain these findings to the patient, then move further. Okay, this is what you will do. Then you will go further to the management. So you will tell about the management. Okay, and in the management, it would be patient-centered. You will treat in the priority order. Can you get 4 out of 4 in management? Yes, you can get 4 out of 4. But the most urgent thing first, we need to keep you in the hospital. Is that possible that you will stay in the hospital? Double check that. Yes. Then discuss cardiology results. So then we'll discuss with the cardiology team or something like that and give the information in chunk and check method. Are we on the same page? Shall I repeat any information? Any other concern you got? Any other expectation from? You keep asking, managing patient issues. Always think what patient want to know, what patient want to ask. How to safety net it? So there's a different way. I'll be sending you home, but I will give you reading material where there is everything, what to do, what not to do in next 24 hours or in next like few days. So if you think it's like a chest pain, radiating, call 999. Otherwise, speak to your GP 111 because NHS want to know that you won't increase the waiting time as well for the A&E because some patient need just outpatient appointment from GP. So you should be a good junior doctor to tell who need to go to the GP, who need to go to the A&E. This is what you need to know. Reading material will tell you, and you can do both of these together. So I will do one simulation with Zahra now. And okay, Zahra, can you briefly tell me scenario you are going to do?
We are going to do the headache one.
Headache, okay.
Yeah.
Can you briefly tell the setting of your scenario so that the people will get to know about that? Then
Yeah.
after they will be starting headache.
So it's an FY2 in the GP surgery, and there is a 31 years old female. She came with a complaint of headache. Yeah, so she this is the main complaint, and along with that, she got cough, flu for the past 4 weeks.
Okay.
So it's a GP setting, yeah.
So what's your name?
There is no name mentioned. So
Okay, give me a
Anna
name.
Maria, yeah.
Sorry, Maria?
Maria is fine, yeah.
Okay, that's fine. So let's begin now.
So she don't have any findings. Oh, sorry, yeah. So she got a flu, which is green in color.
Green.
Yeah.
Okay,
green.
no problem. Yes. So okay,
Um,
I got the scenario settings. Okay, got it.
You got it?
Yes.
Yeah.
Okay. So after that, we'll discuss the approach. First, we'll do the. Anyone going to keep the timer for me, please? Dr. Zubda, can you please keep the timer for me? And 8-minute
Yeah,
timer.
sure.
So when it's 2 minutes left, okay, let me keep that timer myself then.
Shall I put it?
Sorry?
Shall I?
Yeah, please. It's better for you. So you keep the timer.
Yeah.
So I'll focus on simulation now. Before 2 minutes, just go that.
All right. Hello.
Hello.
I'm Zara, one of the doctors here. Can I quickly start by asking for your full name and date of birth, please?
My name is Lita. I'm 31. I'm 32 years old.
All right, Lita. And what brought you in today?
I'm having headache. Probably like quite worse. It's quite here headache or here headache. I don't know what's going on.
I can see you're in a lot of pain. Have you tried some painkillers? Have you?
It's not too much, doctor. Just like I feel like I don't feel good. I don't feel well.
All right.
So I took paracetamol anyway, so it relieved a bit, but still, it's
All
there.
right. So just can you tell me, like, when did it, like, where exactly you have this headache? You mentioned.
Oh, doctor, it's around here. It's around here.
All right. And when did it started?
Oh, doctor, it started like it started 3 days ago, but it's getting worse now.
Worse. All right. And is it like continuous or it just comes and goes?
Um, it is continuous, but sometimes it feels worse. Like
Or and anything you mentioned paracetamol, is it helping for the like last 3 days?
a little bit, but sometimes it don't.
All right. Anything that else that helps with the headache?
Not specifically. What do you mean, doctor? Like what would help?
Like, have you tried some Lemsip or things like that, or any?
Oh, sorry, what?
Have you tried like any other painkiller apart from?
No, I haven't tried really. But doctor, I noticed one thing. When I move like this, it's like yeah, I feel much more headache.
All right. Okay. And can you score it on the scale of 1 to 10?
It's quite like when I move forward, it's like 7, 8. Otherwise, 5.
All right. That's quite a lot. If you move forward, anything else apart from the headache?
Yeah, doctor, I have noticed like something coming out of my nose. Is like a green jelly, like something coming out of my nose.
All right. So you have to blow it, or it's just coming like having a blocked feeling, or?
Yes, quite a bit. Yeah.
All right. And
Oh, doctor, I forgot to tell you. 3 days ago, I was having very bad flu. I've been vaccinated for flu, but still I got flu. I don't know why. And after that, it's all started.
all right. Okay. And anything else apart from this?
No, I'm generally fit and well. It's not much.
All right. Any fever?
Yes, when I had a flu, my body, I was spiking temps, and I checked my thermometer as well.
All right. Okay. Any cough with it?
No, I'm not coughing. No.
Have you noticed any change in your vision, like blurry vision,
No, my vision is okay.
or any discharge from your eyes, like watery discharge?
From my eyes, it was, but now it's improved.
All right.
I feel very sore over here.
Oh, so it's particularly here the most. All right. Any stiffness in your neck?
No,
Any weakness in any part of your body?
no.
All right. So you mentioned it's for 3 days now. Has it happened to you before as well, like the same type of fever or headaches?
Before, no. I don't remember. I don't remember.
All right.
I
Okay.
was totally okay before.
All right. Good to hear that.
Glad.
Just few questions about your general health. So are you diagnosed with any medical condition, like any high blood pressure?
Yes, but it's not diagnosed. I'm quite autistic, but it's not diagnosed.
All right. Okay. Well, we'll definitely look into that as well. Any medications, long-term medications you were taking?
No, I'm not taking any.
No. Any family history of any medical conditions? Like
Um,
any headaches or any migraines or?
yes, my mother do have like eczema or something like that, but not related to this.
All right. Okay. Any allergies you have?
Allergies? No allergies. Yeah, no. I'm
Yeah,
good.
no. All right. Okay. What do you do for a living?
I work. I'm a teacher.
All right. That's nice. And any stress at work? I know it is a stressful job sometimes. So,
No, I enjoy it. I enjoy
oh,
it.
good to hear.
I'm a primary teacher, so I love it. So
Oh,
I love kids.
good to know that. Any recent, dental procedures if you have any?
Dental procedures, no.
No. All right. So I've taken my history. I just need to examine you if that's all right with you.
Okay, yeah.
Yeah. So I just need to examine your blood pressure, temperature, pulse, and heart rate, and I also need to examine your ear, nose, and throat if that's all right with you.
Okay, yeah,
Yeah.
that's fine. So, there
Well,
is a nasal discharge. There is a green color discharge, and there is a tenderness on the nasal area.
all right. So Maria, have you are having this headache for like this pain for like 3 days? Have you given a thought what could be the reason?
Doctor, I'm not quite sure. Maybe there's something serious going on, like tumor or something like that. Maybe infection in my brain.
Well, you are thinking, I can see that you're quite worried about it. I will discuss the diagnosis in detail with you in a while.
Okay.
There's nothing to be worried, to that extent at the moment.
Mhm.
Any concerns apart from that, if you have?
No concern. Just I want to know what's going on.
All right. And any particular you're expecting from us? Any particular thing you are expecting from us to do?
No. Just I want to know what's going on, how you can treat me.
Yeah. So Maria, based on our discussion and after examining you, so there's nothing to worry about it. It's not like an infection in the brain or some tumor. It's just you are having something called acute sinusitis.
Oh, what is that, doctor?
Well, Maria, it's like there are small pockets on our face. So
Okay.
yeah, so they have their function, but sometimes they can get infected and can give the symptoms you are having right now.
Oh, okay.
Yeah, and as you are having a green discharge, that could be because you are having a bacterial infection right now. All right.
Okay.
Yeah. So Maria, because I mentioned that you are having an infection, so we might need to give you some antibiotics for that. Will that be all right?
Oh, okay. That would be very great, doctor, if you're giving me antibiotics. Thank you very much, doctor.
Yeah. So with the antibiotics, I mean, we have to give you some steroids as well, just for 2 weeks, but it will really help you to relieve the symptoms.
Oh, okay.
Yeah. All right. And just keep yourself hydrated. Just take rest.
Okay. Thank you very much,
Time
doctor.
up.
I'm okay. Right. Thank you very much. So, guys,
Made a lot of blunders.
thank you very much. No problem.
Yeah.
So, Sadia, Mo, Dr. Mo, or Hisham, you want to add positive things or what Zahra can improve and what the positive in her consultation. So every time, so I want you guys to score anyone, even your colleague, on the basis of these points. So I will tell you guys how according to the exam guidelines, how will you be scoring her data gathering, and data gathering itself contains Socrates. So I will ask you question: Is she done Socrates well or not? First question. So I want you guys to think about that. Then the next part is DDs and red flags. Have she done enough DDs or not? Then the next part is, although she already knows a sinusitis, but as a safe doctor, have she done enough DDs or red flags or not? The other part is, have she ruled out at the moment? She's going to see a female periods, menstrual migraine, or if she need to rule out or not, she would have a reason. I'll tell you. And now coming to the Mactosa, Did she ask everything in the Meptosa or did she miss anything? And what is the most important thing in Meptosa to be asked? Then I'll show you one sketch. Guys, I prepared that sketch for you guys. I'm covering all headaches in one sketch. Everything, all type of headaches. And trust me, guys, one scenario always in one exam, that I'm right or wrong, headache do come. So like there is some approaches in which headache do come. I'll show that sketch in a minute. But before that, I want you to score this on score that thing on. After that, I'll go through the approach and I'll do another scenario with the Dr. Zara. After doing that approach, I'll ask Zara to give me any headache. I won't say that because when you'll be practicing, when you prepare for headache, you should be doing straight away that what is the headache. You will be thinking if you already know the scenarios, this would happen. This is what the GMC examiner will who will tell you that guys, what you have prepared scenarios when you'll be in the exam room, don't think that you already know the diagnosis. So my question is, will you pass your exam if you diagnose it? No, you might fail even if you know the diagnosis outside. So there is more chances if you know the diagnosis that you might fail. There is more chances. Okay, Meptosa, then management wise, have she done management and what was the IPS? So let's score it while I'll show you sketch as well. Overall, the consultation was good. She was very polite. Tone was very polite. I was feeling very safe as a patient in her consultation, and she was trying to help me out.